Bermuda Cancer and Health is the only facility in Bermuda that actually offers radiation treatments on island, and that is a very essential service for Bermudians.
Our facility is able to treat 95% of the cancers that can be treated via radiation therapy. Of course, chemotherapy, we can't treat those, but yes, otherwise patients would have to go overseas. They would have to cease work. They may not have the support of family and friends around them. So yes, it has been quite a good convenience to have the facility on island and operated with highly qualified staff.
With the closure, as well as the now added cost of PPE and the difficulty in obtaining PPE, that is now impacting your business model.
The acquisition of PPE has taken up a lot of our time since the beginning of the pandemic, not only in trying to source it and import it, but there's also the concern that when it is received, it might not be the medical grade that you require. And so our clinical teams meet at least twice weekly. PPE is always the number one agenda item for those meetings.
Are you at all optimistic that there will be assistance in covering the PPE costs?
I am. You can't quite predict what anyone else is going to do, but I believe that because the need is so great amongst all healthcare providers, I think that there is going to be some assistance that's provided.
You have been treating cancer patients with your radiation therapy throughout the lockdown period?
Yes, during the shelter in place, which I think lasted about 4 weeks, our diagnostic imaging team worked from home on administrative matters, but the radiation therapy team continued to treat patients throughout the pandemic. So we had to make sure that they had, permission to be able to travel on the roads when everyone else was in shelter in place. And we took proper procedures. We had our team staggered, and the treatment continued uninterrupted because we didn't want to do anything to interfere with the possibility of complete cure. Our concern is that once the unemployment benefit runs out in, I guess, another 3 weeks' time now, and if people are absolutely laid off, there is the concern that they may not have any health coverage at all. There is the concern that we may end up with more uninsured and underinsured persons on our doorstep who we do not want to turn away because our mission is to give this care to everyone.
We saw a recent announcement yesterday that Argus purchased 2 of the island's larger physicians' practices, which was a bit of a surprise announcement. I would assume based on similar concerns with PPE and costs and this new environment.
It caught us off guard as well. So it was interesting to see that yesterday evening. I'm still trying to understand exactly what that means, but certainly, alliances and collaboration, that's going to be the way forward. And to have an integration between a healthcare provider and maybe an insurer might be new for Bermuda, but it may not be new elsewhere. And so I think in this day and age, I think everyone is looking for something unique to ensure that, they can make sure that their entity survives. Fortunately or unfortunately, the demand has been such that we've had to increase our staffing levels. So we're actually expecting a second radiation oncologist later on this year, just to accommodate the numbers that we are seeing, the numbers of patients. So we are doing our best to accommodate everyone who comes to us, to try and anticipate what the need is going to be. And we're hoping that the public will continue to support us as we try and support people through every aspect of education, diagnosis, treatment, and survivorship.